healthcare. My name is Barbara Colbert-Hayes and I'm your host. Would everybody like to introduce themselves and their title?
Maria Rodriguez, MA, Chicago Teachers Pension Fund retiree, and I'm also a trustee on the Chicago Teachers Pension Fund.
Okay.
Dr. Leonard Robinson, internal medicine doctor here of the South Suburbs.
Okay.
Stephen Taylor, former business owner, disabled, amputee.
Thank you.
Robin Jackson, Livingston Church.
Lillian Bacon, retired state worker.
Nala King, HF student, policy debater.
And Melanie King, and business owner, mother, wife. Michelle Hayes, financial crimes investigator.
Autumn Lewis, senior graduate, senior in college, and I'm expecting.
What college are you going to?
Lewis University.
Dora Ivory, retired literacy education coordinator, person.
Okay, and this is our Congresswoman Robin Kelly, Congresswoman Robin Kelly, and she's for the 2nd Congressional District. Would like to say something?
Well, good morning, everyone, and thank you so much for taking the time to be here. I know you could be anywhere else, and you chose to be here, so I really appreciate it. Sylvia Tillman coming in the door.
I don't get to see.
Yes, you do.
I'm sorry,
Welcome.
guys, I turned wrong and I can't see. But I did.
Welcome.
Thank you, thank you, thank you.
But I want to thank you, Barb, for opening up your home. I really, really appreciate it. And these conversations are going on all over the United States. Those of us that are part of the Democratic Caucus, we're holding various, everyone's not doing at home tabletop, but people are doing press conferences, maybe town hall meetings, town hall meetings to talk about the issue of healthcare, because healthcare is still the #1 issue. We've done a lot of polling, just hearing from people. This is the thing that people are still most concerned about, and the Democrats have an agenda called For the People, and healthcare is #1 on that agenda, followed by wealth, really, your pay. I know we talk about how great the economy is, but there's still so many people struggling, making minimum wage or working 2 jobs, and the other part of our agenda is really to clean up Washington, so looking at our own ethical behavior. But again, healthcare is #1. That's what we hear, from people all over the United States. And we are passing legislation dealing with lowering prescription costs. We've had so many hearings on that, on the opioid crisis, and we just had a hearing on surprise billing. When you're in, even though you're in a plan, and maybe you had to go to the hospital and see someone not in your plan, and then you get a bill that you don't expect, you think, the bill's going to be covered, and it's not. So again, thank you for being here. Really, I'm here to listen to you, and we hope that this is the beginning, but you were #1. Many tabletop conversations in my constituents' homes. So thank you again so much for being here. I really, really appreciate it.
Thank you, thank you.
So, does anyone have any questions or concerns for the Congresswoman that you might want her to address? She's here. Does anyone have any concerns?
Or sharing your experiences.
Yes.
I'm
Yes.
really interested in.
Healthcare today.
Yes, healthcare.
Oh, okay.
Or it doesn't have to be yours. Maybe you heard it from
Yeah.
someone else, and you
Yes.
just have a concern,
Right.
dealing with healthcare.
Other than the cost, the cost of healthcare, which is everyone's concern. I am a retired person, so I'm on Medicare and Blue Cross Blue Shield is Advantage, primary choice is my healthcare provider. But just the cost and being on a fixed income and all the things that go along with that.
We hear about that a lot, especially seniors having to choose between their medicine and the food they buy, or taking half their medicine to make it last longer, which is not good for your health. Your doctor wouldn't like that. So we do hear about the cost a lot, and again, we've had a lot of hearings about lowering prescription costs and what we can do about it. And one thing, again, as I was saying a little earlier, is doing things so we can invite more competition and working with Big Pharma, frankly. You know, I know they don't want to be the enemy, that's how they're feeling now, that they're the enemy, but when we have hearings, they talk a lot about they're the ones spending the money, you know, for the innovation. We're the innovators in the United States, so sometimes they may be working on a solution to a disease and they've spent all this time, all this money, and then it doesn't work out, so they have to start all over again. So that's some of the reason they say the cost is high, but we still feel that even knowing that on top of that, the cost is still too high, and we need more competition, more generic drugs. An example that someone gave me, she has asthma, and she uses an inhaler, and her inhaler costs $325 in the United States, and she happened to be in South Africa, forgot her inhaler, and that exact same inhaler,
Right.
looked exactly the same company, same everything, was $25. So, I mean, you know, so that tells you we have to do something about this.
But Congresswoman Kelly, is that because of the patents here? And they're saying, so in order for us to do it, there's a patent here, so no one else can make those same inhalers or whatever it is, because they always say, go to Canada, go to Mexico, go anywhere. I've got clients who have health conditions, and some will say, I'm going to Mexico for my care because it's so much cheaper. And I understand cost of living is different, but there's got to be something else. And as a small business owner, my husband and I are both small business owners. We left our jobs, and of course, our biggest expense is healthcare, our insurance costs, and it's so overwhelming. And then prior to Obamacare, we were definitely excited about it, but then prior to that, we just were paying out of pocket, and it was fine. We paid maybe about $6,000 a year, which was doable. But once we got under Obamacare, we saw definitely the benefits. But then we also realized there was a high price tag attached to it, and we didn't qualify for the assistance. I guess the government gives some assistance depending on what you make. We didn't qualify for it. So we paid, I believe it was $12,000 or $12,000 to $15,000 per year for our health care, which was, and we kept saying, well, we were excited about Obamacare, but now we're paying substantially more. Whereas before, we could take our kids to the doctor and, everything else, preventative care, everything, and we just would pay out of pocket, and it was much cheaper. So are we doing anything to address that?
Well, I don't think I wasn't there when the Affordable Care Act passed, but I don't think there is a Democratic legislator that was there that would tell you the ACA was a perfect bill.
Right.
Well, there's no such thing. But also, I think President Obama, he tried to be collaborative, and he made some changes even from what he wanted to do to get some Republicans on board, and not one Republican voted for the bill. So he might as well have done, what he was going to do. But the ACA has made a tremendous difference. We see it in African American male health, some things that have been cut, even African American women with breast cancer, that's gone down. Definitely many more people have insurance, but again, no one will tell you it's a perfect bill, and we know that there's things that need to be improved, but for 6 years, or really 8 years, but I was there 6 of the 8 years, we've been in the minority. As we say, we were in the desert. And over 60 times, I didn't vote on all 60, but the Republicans tried to appeal of the Affordable Care Act instead of trying to improve it. So that's what we dealt with for the last 6 years until January, when we got into the majority as Democrats. So now we are trying to look at lowering prescription drug costs, and we hear a lot of concern about the premiums that people have to pay. So we're looking at all of that. Also, I'm working with the Tri-Caucus works together, the Black Caucus, the Hispanic Caucus, and the Asian Pacific Islander Caucus. We work together. We have a bill dealing with health equity and accountability. So we're looking at what we can do, to bring prices down. And the other, just little thing I feel compelled to say, that people think we have free health care and that it's paid for, and our health care is not free. And like you, my health care is more than ever paid, even though if it helps other people, for me personally, especially being an elected official, I'm glad to do it if it means other people can have health care, but I know, I hear your pain from, you know, a lot of people, but we just have to we're passing some of these things in the House, but we can't get them passed in the Senate because the Senate, you know, he won't, he won't even take up the bills, but there are bills coming out that deal with making healthcare cheaper. There's still more to do that we have to try to figure out, and you know, when we have hearings, like someone said, it's on all of us, not, I mean, the elected, insurance, the hospitals, big pharma, everyone has a piece of, you know, why things are like they are, and we need to continue working together to see, you know, what difference we can make.
Are you not concerned about the small announcement that came out of the president's office about now that he's gonna let the small businesses give money to their employees and they can control their, what they do with it for their health care? This just came like yesterday and I thought, boy, that is a red flag.
I didn't even realize
I'm
that
sorry.
he said that, but I'm concerned about many things.
It's bottomless.
Right, the
Yeah.
White House, he's very much into, in a lot of different ways, you know, privatizing everything, and so yes, I'm concerned. I don't think he has a good understanding really of what's really going on, quite frankly, because he tried to, you know, that was his thing, he was gonna take it away and we were gonna have a great plan, and really there was no plan, you know.
We're playing with what we have.
But he is chipping away,
Yes.
as you said, at, like,
And
you
it's
know, we
scary.
had the navigators, we had, he took away 90% of the money for the navigators that would sit down and speak with people individually. Also, he shortened the time that you could even get into, the registration or, period where you could even get health insurance. He shortened that, I think, from 3 months to 6 weeks. So there's, and changed, you know, the money changed dramatically. But, you know, people worked really hard to get the word out, so a lot of people still applied, not as many, but also, more people have jobs, so, and most people get their jobs get their healthcare from their work, so that helps too, but we are really trying to, cover the people that don't have healthcare. And when he took away the mandate that you had to have it, so a lot of younger people, you know, didn't bother to get it because the fine to not have it was worth it to them. You know, it wasn't as costly as getting health care. But the thing we need to think about is, you know, there are things that happen unexpectedly. You could be in a car accident and go to the emergency room. So we're paying for that if you don't have, you know, health care. So we do need to make sure, you know, that people do have health care.
I have two friends that are nurses, and we had a conversation. Unfortunately, they were not able to be here. We were really bummed out about that. But one of the commonalities that they had, along with myself, is that you can't talk about healthcare without talking about nutrition. And yes, and so one of the things that we talked about is what's on your plate is, you know,
You were singing my song.
My one friend Tamara is a school nurse, and one of the things that she noticed and she talks about a lot is the food that they're serving at school, and how that contributes to even hypertension with some of her teens when they donate blood. And so I was just curious to know if that's something that's been talked about as far as, you know, processed foods and things like that.
I did a report, I'm trying to remember which year now, the years fly by, the Kelly report on healthcare disparities. And the top 10 diseases that people die from, African Americans are number 1 in 8 of the 10 diseases. And the doc can jump in if he thinks I'm saying something wrong, but a lot of that is you know, our lack of our diet, how we eat, and so many food and your weight and all that contributes so much to your health, like, you know, high blood pressure, diabetes, and so it's funny, I've been saying for a long time that I wanted to do like a pilot program. I've talked to women in the 4 historically black sororities and use that as a pilot to start there, to see how we could work together to at least, you know, use the sororities as a pilot program to do something about how we eat and the nutrition and those kind of things. But no, we need to do a better job for sure. And I know when I was coming up a long time ago, we used to have home ec, and we talked a lot about that. And there was more, and then also, you know, gym and all of that. And when I was in the legislature, the state legislature a long time ago now, that we used to have legislation where school districts are trying to opt out of gym. We used to vote on that, either they couldn't afford it or because of other things they wanted to get in. And we need to have our young people learning how to eat right and exercising, not just, you know. And the other thing is, it's interesting, in some schools, because of Michelle Obama, they did change how they were eating, but I guess, I don't know, some schools did not make that change. I thought they all were supposed to, even though we get complaints, oh, the kids aren't eating it, and you know, those kind of things. But I think that if you never expose young people, you make veggies seem you know, then that will be, you know, the attitude. But it has to be not only in the schools, but at home too, which is really, really hard. But no, we talk about nutrition a lot, and certainly in the report, you know, I talk about it, nutrition and your diet, and also the importance of moving and doing, you know, something. But of course, you can't legislate, you know, what you eat, or you know, how much you eat, or you know, exercising. But what we try to do, I'm the chair of the Congressional Black Caucus Health Brain Trust, so we've had health forums and health fairs in different places around the country. So just trying to educate, you know, the public. You know, we've done things like that. But it's funny, we had them. And then, like we had one in the church, and you know, need to do this. We had Zumba, you know, blah 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 blah. And we even gave away like food from like a farmer's market. But then the church had macaroni and cheese and project. Like, okay. So you know, we all have to be a part of the change.
Thank you.
In the schools now, do they? I mean, as a doc, yeah, you're so right about it. It's really all, most of the diseases you probably talked about were things that could be affected by your lifestyle and culture. So really the only way that you can change that is through education. Right. And you know, as you say, there's a lot of the schools and districts don't have the funding for it. So is there something in Congress now where they legislate that you have to have health care and you have to have gym? Because I think if they sort of leave it up to the local districts, they're just going to say, you know what, we don't have enough money for that. And so it almost has to be something that comes from above in order for it to sort of trickle down and really have an effect. But that's really the way to go, is to educate starting at a young age. At one point I was the president of the American Heart Association out in South Cook County, and that's what we would do, is we would go into the schools and give like the first graders a program. And then we have a different program for the second graders, and it's all the way up, so that eventually, but that was just a few schools that we just happened to. But really, to have a long-lasting effect on healthcare, it's got to be something sort of global.
Right.
Otherwise, it's, you know, if you just sort of hit and miss it with going to a church or whatever, it's probably not going to have any sort of long-lasting effect.
It was interesting when I got to Congress. This is something that I didn't even realize as much, even though I was a state rep, how education is so state guided. And I mean, we definitely have an education and labor committee and run by a fantastic person. And this time well, we have to see what passes, but there are various types of appropriations put in for schools. But I have to look to see as far as what you're talking about, but it's so state driven, and then they take, you know, the money, like when you see a listing of the very healthy states compared to the not healthy state, so I'm sure the schools feed like that also, you know, and what a cultural, you know, environment is, but I will go back and speak to, the head of it is, Bobby Scott from Virginia. He's the head of, education and labor and does a great job, but I'm gonna pose that to him, you know, can that be done, do we have that kind of jurisdiction, yeah.
Piggybacking off what they were both saying, I suffer from diabetes and kidney disease. I've been blessed to travel the world through basketball and stuff, but doing that, I see different cultures in different countries that handle healthcare a completely different way. One of the most important ways is that they're not searching for treatments for healthcare, they're searching for cures, and they're finding cures, and they're curing these diseases. With cure, it wouldn't really be much healthcare needed once you cure it.
Right.
With that being said, one of my questions would be, how serious are we as a government about finding cures? And as far as still research, as far as other things, because the science is out there. It's just whether the FDA approves it. And it's been well known. And then I've been to some places where these are small countries. Some may be considered third world countries. But yet we're still one of the most obese countries in the world, one of the most unhealthiest countries in the world. And it's getting to the root, like what she said and the doctor said about the diet. The root of the problem with healthcare starts with the diet, the lifestyle, and also cures. You wouldn't mind paying that $1,000 for a doctor treatment if you only had to go once in your whole life. You know what I'm saying? Healthcare is not, it drives the value up then. And you don't mind. If you had a car that lasted for 30 years and you paid $30,000, you wouldn't mind. But if you had to buy one for $30,000 every year, it's a problem. So my question is, how serious are we about starting at the root, meaning finding cures, and also, like you said, the education. It can be done if people make up their mind they want to do it. And the government it's mandatory that you do 4 years of English in high school. Why isn't it mandatory that you do so many years of gym in high school? How much more money does that cost?
I can't answer how much more money that it costs, but it used to be like that. I remember taking gym, every year, but also I think it's just lifestyle change. So many of our young kids, I mean, a long time ago, we didn't have, I can't even name all the games. We didn't have all the videos, and, kids
Cell phones.
kids, cell phones, kids did go. I know my grandparents and my parents had to call me in every night because I was just the road for, doing whatever, but it just seems, very different. And, also, in some parts of where I represent, and certainly some parts of where my colleagues represent, parents are afraid to send their kids outside because of, the violence in some of our communities. So that's not even an option, some of the time. But no, I'm all for starting at a young age and teaching what's, proper to eat and encouraging exercise, but also, kids do what they see. Also, you know what I mean? So, no, I think all of that's very important. If you talk to people here, companies, pharma, researchers, I think they would tell you that we are serious about it. But one issue is, now it's gonna change now as far as the House is concerned, but we are putting more funding into, the National Institute of Health and the Center for Disease Control. That's happening now. But, that wasn't happening, when I first came into Congress. All of that was stopped. And then I know we're talking a lot about physical health, but even mental health. A lot of that was, was cut out also, which is a problem too. But all of that is changing now. But again, all these bills still have to go to the Senate and they have to be passed there. But I feel like many people are serious about it. Actually, we do have a great number of healthcare people that serve in Congress, doctors, dentists, medical assistants, some nurses that are members of Congress now. I mean, they may have different ways sometimes of looking at, what we should do. unfortunately, some of my colleagues, they have the, pull yourself up by your bootstrap mentality, but if you don't have straps or boots, you know, it's hard, you know, to do that. But we can look into different ways, even like the, SNAP program or food voucher program and things like that, but I don't know if you can legislate, you know, what a person eats.
Well, we always talk about funding for different things whenever people bring up issues. The first thing is about funding for it. Without funding, that's because there's some free things you can do, things that can be done without funding needed, like putting stipulations on some of these food companies and what they're using. Like, it shouldn't be fair that you can call something 100% juice when there's actually only 60% juice in it. So that would take funding to do that. Let's just put stiffer laws on these food companies, like the processed foods with all these carcinogenics in it that cause cancer quicker than a cigarette and stuff like that. With
Now, we
those
have talked about
stipulations.
that. We have talked about different labeling and people saying something is organic, or like you said, I just saw something where they showed a Coke and they showed grape juice, and actually the Coke had less sugar, less calories, less everything than the grape juice, and it said, I'm trying to think what the label said, but again, but I think that goes also back to education, reading the back of the can or the whatever, and trying to get people to use fresher foods and that kind of thing, but of course, fresher foods are more expensive. And then there goes to, we have food deserts in, you know, too many places.
As both gentlemen mentioned, and you're absolutely correct, and as a former teacher also, but we have a great problem in African American Latino neighborhoods, and a lot of it has to start with education, because as far as diabetes and hypertension, it's prevalent to our culture. And a lot of these children, and I agree with you, Congresswoman, and everybody's texting, not getting the exercise, but look at all the commercials, look at all those sugary cereals, everything that they're being geared to. Hey, this is great, get this, buy these candy bars, and a lot of these, they say they're healthier, these juices, I've read them, and it's like, okay, it's supposedly healthy, but look at the amount of sugar, the amount of sodium, and there's my problem, hypertension. I would like to address a couple of issues, and if it's okay, turning around a little bit, but it's still with health, and some referring to, you know, as we say seniors, but I like to be called, we're seasoned students of life. I've been in that category for a number of years now, but one of them, and I'll just, you know, mention them, but I'm gonna read it off by text, not all of it, just because there's a couple of issues. Of course, we're all concerned with the high cost of prescriptions. It's outrageous. And when people, especially seasoned students of life, have to make a decision, what am I gonna do? Am I gonna pay my heating bill this winter? Or am I getting this prescription? Or I'm taking care of my little darling, my little grandchildren? Because my daughter, and I had a woman come to the pension fund and say this, her daughter was unexpectedly, recently passed away when she had been murdered. She was raising the grandchildren, she could barely make ends meet. But the high cost of prescriptions, which we all agree across the board, whether you're receiving a pension or not, or seasoned student of life, the Express Scripts, the premiums continue to rise. They continue to rise. But also a lot of the drugs prior to being 65, which I passed that age, prior to 65 were approved, but after you're 65, now you need approval for some of those. And it's, well, what's changed? And that's a lifestyle change for people as far as what is your priority. All right, so a lot of drugs now need prior authorization. It did not before age 65. The insurance premiums are all too high across the board, which you know whether you're a seasoned student of life or not, but especially for people who get pensions, because there's a great misunderstanding, or I'll talk slower, I'm sorry, I get passionate
No, that's
about this.
it's on tape.
Oh,
It's
okay.
like
As far as, okay, now I lost my train of thought. Pensions, there's the misunderstanding that if teachers, oh, you collect Social Security, receive a pension. No, it's either or. It's either or. So, and Social Security, years ago, people thought, oh, I have Social Security. That's how I'm gonna support myself later in life. And everything was really, it was different. It's just exploded, you know, so now you can't. And even with pensions, there's teachers who receive pensions, and I started at $10,500. Starting teacher, forgive me for not knowing, it's over, close to 40,000. But with the cost of living, it's really nothing. And we have pensioners who are still making $19,000, $20,000 a year. How can you live off of $19,000, $20,000 a year? That's heartbreaking. But okay, so there's still a category of pensioners that receive that low amount of their pensions. All right, so then you're into Medicare. Say, okay, now Medicare, it should be better. But even with Medicare, it limits the ability to obtain certain procedures. You have to get priority, you have to get approval for that first. And some of those procedures under Medicare, you can't get the approval. It's crazy. Has anybody gone through there? I don't know, I may be the seasoned peak person here.
But I know.
Approval for
I have-
procedures?
For certain procedures, yes.
Right,
Yeah.
some pre,
And doctors, there's different doctors, and then now you have a different list on your doctor, and you have to, sometimes people go outside of, because we get insurance through the Chicago Teachers Pension Fund, and if your doctor's not on a list, you have to go outside and then still pay. So that's difficult. Same thing also, some of these insurance companies, if you need home care, they're not approved. What do you do? In my case, I'm one of those. I don't have children, I have extended family, and I have a brother 16 years older and 12 years older. What's gonna happen to me? God, I've been blessed with health this time, but we all have to think for the future. And I'm sure there's many of us. A lot of teachers are single, and they got so involved with their career. Home health care, who's gonna pay for that? What's gonna happen to us? We don't wanna be a burden, and trust me, a lot of seasoned teachers that retired, they could work, we would still work. But Congresswoman, what can we do to help you and support you? You say there's committees, there's a lot going on there. What can we do to help you?
Really, the reason the ACA is still the law of the land, because the public raised their voices. I mean, and I think that sometimes the public forgets their power and they forget their voice, and we tell people, to write, call, email, we don't fax anymore, but, and to now, luckily, for this area, I'm
Right.
with it, and Dick Durbin and Tammy Duckworth are, but if you have family and friends, that live in some of the other areas, to put the pressure on, those folks, because really, people do look at the people from their district, calling in, but if you have friends and family that live other places, or get involved with groups that are, advocates, like the Chicago Teachers Union definitely speaks up for itself. But I mean, a lot of like AARP, they are fierce, I will say that. I remember when I was a state rep, and it was at the end of the year, you're tired, and we used to laugh when they called us out like, oh no, no. I mean, they were so nice, but relentless and fierce about, whatever you didn't call it senior, but your seasoned liver of life.
So write a bill to get that changed.
So, getting involved in groups that are pushing your ideas or advocating for things that, you think are right. And as far as, with me, beside, the, bill with the Orange Book Transparency Act, like I'm still working a lot in the gun violence prevention space, which is a public, health issue. And then also working a lot around, the MAMA Act with maternal mortality and morbidity, because as a lot of people have heard how so many women die every year, from childbirth. They may not die right away, and we worked a lot with Judge Hatchett, because she lost, her daughter-in-law, and actually it's like domestic violence. It cuts across every socioeconomic level, but like many things, with Black women, it happens, 4 to 1 times the rate, and unfortunately in Illinois, 6 to 1 times the rate. But in the state of Washington, with Native American women, it's 8 to 1 times the rate. So we have legislation dealing with review committees, collecting data, looking at best practices around the country, like why does it happen more, in some areas than it happens in others. But one thing, you know, a lot of us have come to the conclusion, not talking about you, Doc, but that women are not listened to as much or as closely or as timely, you know, when they, you know, when they're visiting with their medical professional. The other thing that research has shown, one of the things we work on a lot is diversifying the healthcare pipeline, because research has shown that you do better when it's someone that looks like you, that is working with you. So we really believe, not that you're always gonna have that, but cultural competency is really, really important also. But that is, you know, a major problem with 700 to 900 women, and they may not lose it like right away. It might be 2 months after or 6 months after. So that's something we're working on that's really, really important. And again, working with the Tri-Caucus on the Health Equity and Accountability Act, and that's all about closing the healthcare disparities among all the people of color, because there's definitely disparities. And again, some of it could be cultural, you know, how we eat, or, you know, access to healthcare is, you know, an issue. So I'm working on all those issues collectively.
But you know, I wanted to say this, I'm on the board for chapter 163 Acme retirees. And we go down, we go down state, maybe Springfield, almost every 90 days.
I know.
I have a problem because I go to my senators and my representatives, and they're Democrats, okay? But the others who have Republicans, they can never get in to speak to them. They're never available. They're in session. How, and when we talk to the Democrats, they're saying, we're on board. It's not us, you know? How do we get where we can get those Republicans to listen to us as people? The last time we went down, the seniors was on wheelchairs, rockers, everything. I mean, there was so many seniors, I didn't even know there were that many seniors in the world. They were down there, you know, and half of us could not get to see a Republican representative, you know, or even the senator. But we got in to see all the Democrats.
Well, one thing also, I mean, you can go to Springfield, but you also can go to their district office, and you can, you know, there's their legislative office in the district, and people can go there. You can, I know people are gonna say, oh my God, why is she saying this? But you can protest, you can sit in their office, and again, when the ACA, when it looked like the ACA was gonna be taken away, people that were trying to take it away, they had to take their phones off the hook because so many people called, and you know, so many people called in, fax machines were jammed. I mean, all people really put the pressure on. So that, I mean, you have to be relentless and put the pressure on, and then, you know, every 2 years or every 4 years or, 2 or 4, people run. And people have to exercise that right too, which we don't exercise our right to vote enough.
And you really
League of
can-
Women Voter, here we
Yeah,
go.
you really can call and make appointments in those offices and go with 2 or 3 people and say you wanna talk about something general, and you can bring up a few other things.
Oh.
But you need to really go and talk to them, or protest somehow.
Appointments have been made for this, but when they get there, they're either in a meeting, or they on the floor,
But
or
go to their home office, not.
But
not
see,
the
what I'm
Springfield
saying, I'm
there.
not talking about ours.
Yeah.
I'm talking
Yeah.
about other people that have Republican representatives. How, and I understand and I hear what both of you all are saying. But it comes a time that this is not a Republican nor a Democrat problem.
You're right. Oh,
This is
it's not.
this is United States
Right.
citizen problem.
Right.
Us seniors, the youngsters, all of us are being left behind because Republicans have their own specific idea about companies. Well, we're the ones that run the companies, but what about us? You know, the state does not realize that home health care for senior citizens saves them thousands of dollars by not putting that senior in a nursing home. Okay, but you can't get them to understand that. Why can't you vote for this bill that says that the seniors have the right to this home care? You know, they have this right. And they're saving state money, but we don't hear that saving state money. You know what I mean? And that's what I'm saying. How do you get a Republican How do you go across the line to
Oh,
try to
yeah,
get them?
I work in a very bipartisan way, and
Okay.
I win some and I lose some. I passed a dental bill, that Trump signed, but, but it passed, but,
Did he know Lee signed it?
yeah, well, of course, when they did it, they had my, it was my bill, but they had my Republican colleague
course.
that helped me.
Okay.
They had him
Okay.
second or
And
whatever,
you
but
were
on
hired.
mine, right.
Uh-huh.
But it was my bill,
Yeah.
but the truth is, it was a dental bill, so low-income seniors, vets, they could get dentistry and dental care because your mouth is a part of your body, and if you don't get dental care, that affects,
Right.
you know,
Everything, yeah.
yeah, your heart,
Everything.
everything, you know, so, but the reason that I could get that bill passed, because there's 5 dentists in Congress, and every one of them is Republican, and they help me, you know, and, so there is more bipartisanship than people think, and we get along much better than people think. One of the people I'm closest with, one Republican I'm closest with in the House is the head of the Freedom Caucus. Now, we very rarely vote alike, but we still have conversation, and I was the ranking member on the IT subcommittee, and I worked with the chair. We were in the minority at the time, and we got, you know, IT bills passed. I just passed something out of committee yesterday, or the day before yesterday, with the help of Republicans. So we do, but you're right, there are some, I'll put it like this, I hate to overgeneralize, but fundamental values, you know, like we are, when I look at us, I look at justice, equity, and opportunity for all, and I don't think sometimes they look at it like that unless there's some money thing involved. Just like criminal justice, some changes we were able to make, and we came to the table for moral reasons to me, and they came to the table for money reasons, because so many people were being put in jail and it cost us so much money, like you said, nursing homes. So it was just so much of, it cost so much money that then that's when they came to the table and said we have to do something about this. So that's how the First Step Act passed. But we felt that so many black and brown people were being put in jail, you know, very unfairly, or for little things that other people weren't being put in jail for. So that's how we were able to get it changed. But I definitely understand what you're saying, but you do have to be relentless, and like Sylvia said, make an appointment, but don't, you could say you want to talk about something else, but once you get the audience. And also the other thing is, people come and see me, and I am voting and I am on the floor, but meet with the staff. The staff is very instrumental and very influential, trust me, because they oftentimes they're the ones in the office and we're running around all over the place. That is true, that they might be, you know, voting and that kind of thing, but don't give up, because I think that's what some people are counting on, that you are going to give up.
But you are absolutely right, and unfortunately, I live in a district where the Republican, and I've gone to their home office. I've called, when it comes a time for election, robocalling. Oh, let me tell you what I really think. And that's the only kind of message.
Oh, yeah, so I had a question about so I heard there are some states that are coming out with new bills and legislation that require a drug test in order for you to qualify for welfare. And the way I thought that related to public health was that addiction is a health crisis that a lot of people can't help after certain parts, and it disproportionately affects a lot of black and brown communities. I was wondering, is there anything Congress is doing about this issue going on in the state? And I know it's like even a money issue, because it's costing states a lot of money to produce these drug tests and not paying off a lot of I'm just asking, what is Congress doing about that?
I'm not as familiar with that, because you said it's in different states, so I'm not sure which states are doing it, but addiction is a health problem, you know, and we need to work on that, not test people. And then also, it's so you're going after the poor, but other people, once again, that have a lot of money that can get themselves out of things or get themselves treatments, you know, they're not being treated like that. So I don't think that's fair. And I think from what the little I know about it, I think that states have found that it hasn't really panned out or saved them money. It costs them more money, you know, to test everybody. And that seems really, you know, unfair. There's some people that may have to get help because maybe they were laid off and have worked, their whole life, so all of a sudden now you're going to test them. That seems unfair to me. And also, drug addiction is an addiction, it's a problem.
Speaking of certain issues that may not seem exactly like it's a health issue, I think you hit on it a little earlier with gun violence. I know that certain hospitals are treating it as a health crisis, and I think you were saying you believe it is a health crisis. How do we legislate that? I know we've talked about restrictions on guns and purchasing guns, but it seems pretty, to me, it seems pretty systemic in certain communities because I know some people in certain neighborhoods that feel as though I have to join a gang. And they've said this to me, and I said, well, why do you feel like you have to join a gang? And they said, because I know I'm going to get shot at. I said, wait, that doesn't make sense. They said, no. I mean, if I'm not in any gang, everybody's shooting at me. If I am in a gang, only the opposing gang is who I have to worry about. But I know I have my protection from my gang, my brothers. And so, and they get their guns, and sometimes we know it's a money issue, so they have drugs, they're selling drugs. But primarily they're saying if somebody does something to one of my members of the gang, we're gonna retaliate. So how do we legislate to stop that? And I don't know that we can, but maybe you.
Well, it's a multifaceted problem, and we have to do many things. There's not one solution. We just finally passed the background checks in the House. We passed a background check bill. We've been trying to pass that forever, where no matter when you purchase or where you purchase a gun, you need a background check. We closed what we call the Charleston loophole because of Mother Emanuel. You have 3 days to, when you go to a brick and mortar store, they can check your background, whether you should get a gun or not. But if it doesn't come back definitively no, then you can still sell the person a gun. So what happened in his case, it didn't come back definitively no. It was a small gun shop. They need their, cash flow. So they sold him the gun, but then it came back some days later, no, he should not have a gun, but it was too late. So we closed that loophole that it has to come back definitively no. Again, those things passed in the House. He hasn't called them in the Senate yet. But what I talk about a lot, I feel like in Congress, I'm the voice for the everyday shootings, because we always talk about the mass shootings. Not that they're not absolutely horrible, but when between last weekend and the weekend before that, 70 people were shot in Chicago. That, I mean, when you add it up, like we said, we have the slow motion massacre, but so that's the voice I feel like I bring the everyday shootings. And when we had the shutdown, I was one of the people that planned that and those kind of things. But, when we weren't in charge, nothing, still happened. But I feel that we need to do more legislation as far as trafficking. That's the problem here. Trafficking and store purchases, how, because that's, they'll say, well, the bad guy is not going to get a background check. He's going to, get his gun in a different way. So we have to look at stronger trafficking laws, because most of our crime guns come from Indiana and Wisconsin, where it's very easy to get a gun, and then store purchasing when I can't have a gun, but you can, so you buy mine, for me. So we have to look at that. Then we have to look at police-community relations. They are not good in Chicago, and they are not good. So we have to look at that. And then lastly, we have to invest in these neighborhoods. It's not just about the legislation. A lot of these young people don't have hope, they don't have opportunity, they don't have job skills, they're not educated, they may not have a parent in the home, they need a mentor. That, and the other part of that is, like Father Flager, he said, people talk about PTSD, post-traumatic. He said we have present traumatic, because we deal with it every day. It's not post, we deal with it every day. So we have to have access to counseling. Some of my police folks, and out here, not just in the city, they say that there are young people that are right on the edge, and if they had, a mentor or a counselor or one person interested in their future, that it would be a whole different ballgame. Even Eddie Johnson said he met 30 hardcore criminals and they were able to change their life around because one person, took interest. So I think it's many things that have to go on, and the thing we fight, like when something happens, someone will say, well, that wouldn't have stopped that. No, that may not have stopped that particular thing, but it would have stopped this, So I think we need to do a multitude of things. And I've been on panels with young men that have been in jail, and when you hear their stories, like 2 of them both said their mother was on drugs and both their fathers were in jail for murder. And so one was like maybe 13, and he took care of his 3 younger siblings. I mean, that is, you're right. And so he got into the gang life and got in trouble, went to jail. But he was talking about this one organization, a guy from the organization that helped him turn his life around. And now he's helping to turn, other people's lives around. But I think we need to do a multitude of things. It's not just one thing. And then also, the access to guns, because so many women die from domestic violence, because we had people come and present to us that the guy was in jail, and then he got right out of jail, got a gun because he was mad at the woman, and came and shot the woman. One lady had her hand on the door trying to prevent him from coming in, so he shot her hand, but her dad was there and her 6-year-old son, so you can imagine the trauma that they face. So it's not one thing. I think it's a multitude of things, and the other thing is, which I'm hoping that we can do with these appropriations bills, that there are some good programs. Like Diana Latiker in the 9th Ward has Kids Off the Block. There's a program, Polished Pebbles. There's a program, Dem to Fem. And but if we could scale up the good programs, like one is My Block, My City, like that. And I mean, they're doing great things trying to expose young people, but they only can expose so many young people at a time. So we need to scale those programs up and really evaluate the programs that are working, because that's part of the problem, that people put together things and they've been bogus. So that ruins it for the people really doing good things. But access to guns is a problem. We need mental health counseling. I hate to generalize, like I said, but the background check bill did pass in a bipartisan way. Not a lot of Republicans, but some Republicans were happy for that. But they blame mental health for everything, and people that have some mental health, they get hurt more by guns than they hurt, other people. And the thing about gun violence, 2/3 of gun violence is suicide. And then it's homicides, and then it's accidents. So, you didn't lock up your gun, kids were playing with the gun, the kids that bring the guns to school, like that kind of thing. So, we still have a lot of work to do, and, but elections have consequences, that's all I can say. And, depending on who's in office, that's, what's gonna happen. But, I think that definitely even Democrats are more sensitive to the everyday issue, because a lot of people said to me, God, what is going on, in Chicago? We know it's not just Chicago, percentage-wise, St. Louis, Detroit, there's other places, but it's just the numbers here, but hopefully with the new mayor, there'll be some changes, also, and she'll have some other, ideas or just different things, that we can do. I'm hoping.
And just piggybacking quickly on that, does Congress share its findings with maybe even with the states? Because like you're saying, you all are you're researching, you're finding that, you need to do X, Y, and Z.
I actually did the Kelly report on gun violence, and so a group I just met with in Illinois, they asked me to send it to them because they're a part of the RAND Foundation, and they're giving $40 million to the Chicagoland area, so they wanted to see what I did, and I know my report has been read, but we try, but you know, we can't, again, like in this state, I don't know if the prior governor would have read, you know, so, but I'm in close contact with most of my state senators and state reps, you know, they're, you know, aware, and you know, they send me things too that they've passed, you know, in the House, but yeah, I did two things, the Kelly report on health disparities, and there are some groups that make their new staff read that, and actually, I think it was this one, we happen to be going online, and someone, we didn't even think about this, they took the report, they're selling it, they're selling my report on Amazon. It was binded, and I was like, oh my God, you know, yeah. But we never thought about.
No trademark.
I know. We never even thought about anything like that. I was like, ooh, that one. But I'm getting the signal that our time is up, so I just want to thank Barb again, and thank you for your wonderful moderating, and just really thank all of you for being here, but don't let this be the end of us hearing from you that, you know, have a great team, and you've met some of them, and you can always call our office, or you can always call DC, 202-225-0773, that's where my policy people are. I do have a specific person that works on my healthcare policy, so we are always interested in what people think. We have an open door policy, and we don't have all the answers, and so we want to hear from people about their experiences, or what you were saying about, you know, people that are disabled and things like that, and so we know, you know, what our constituents are thinking, and what we need to look into. So again, thank you so much. Thank you for opening up your home.
Thank you for coming
Of
here
course.
and listening
Yes.
to our opportunity. We got it firsthand. So thank you for your leadership
Yes,
on healthcare and what you're doing for the community at large. So with that, we hope to have another table talk with
Invite
you
me
soon.
back.
All right.
Thank you very much, Congresswoman.
Affordable housing.
Okay, I mean,